pay for your medical bills. A right to life is the right for you to make your own choices about your own life without interference from the aggressive actions of others. It's about who owns your life. You, your neighbor, the state. That's why the only proper formulation of a right to life is you have a right to your life and only to your own. And this mutual agreement to refrain from using force to get what we want and even get what we need, that's what creates true community, where other people exist as values, not as threats or unchosen burdens. This is the basis of a benevolent society and peaceful one. It's where healthcare is recognized as an essential value and not a claim on the life of another human being.
So now at this point, if you've written down your questions for the speakers, we'll be going down the aisles and collecting them. If you don't have your questions, after the second set of rebuttals, we'll once again come down the aisles to collect your questions.
As a practicing physician, I can tell you that what Dr. Haynes said is more theoretical and not what happens in reality. My own father died of cancer, and prior to dying of cancer, he was in his 80s and had Medicare, and he could go to whatever doctor he needed to see, get whatever test he needed in a timely fashion. When I see patients that are over 65 and over right now who have cancer and are in Medicare HMOs, many times they have to get pre-authorization before they can come see me, and the ultimate delays in terms of getting each and every test is numerous. The idea that the private industry is less invasive or less rationing of care than the government is simply not true. There is no data to support that whatsoever. If anything, I will tell you that when you have a for-profit industry that only makes money by denying care, it's in their best interest to ration care. And that's exactly the system that we have. If you can show me one instance where the private sector does less rationing than Medicare does, I think then there's a legitimate argument to that. But that's not the fact. I can't speak for what happens in Britain with people over the age of 65. We're not arguing about, we're not proposing that. That is socialized medicine. Socialized medicine is when the government owns the hospitals, employs the doctors, has every single bit of control over each and part of the healthcare system. What single payer is, doctors still work for themselves, hospitals will remain independent, but instead of an insurance industry that takes 31 cents of every dollar away from actual patient care, it uses the existing revenue to put it back in by reducing administrative waste. We don't need to put any more money into our healthcare system than we have right now. We just need to get rid of the middleman who only cares about padding their own pocket. That's what a single payer system does. Finally, I will say that the moral argument, listen, I have a lot of respect for Dr. Haynes, but we see this philosophically different. The moral argument is what you either feel. Either individuals are responsible for themselves and should not be responsible for those around, or that we as a society are greater by taking care of the least among us. That's something that you all need to decide amongst yourselves, and that's something that no one can make that decision. I choose the latter, but I have full respect for those people that believe in individual responsibility as well. Thank you.
This was the part I was going to wing, so now I got to figure out stuff to say. There is no such thing as free health care. Somebody's going to pay for it, and whoever pays for it has to set some limits. We do not have infinite resources. And we have to divide up the money that we have amongst various values. As soon as you put your money into that common pool, who ends up deciding what those limits are? And it used to be that people would say the Soviet Union had the best healthcare system in the world. It's hard to believe, but that's what they said. Well, Soviet Union tanked. Then they were saying that Great Britain had the best healthcare service in the world about 30 years ago, and that started going under. Then everybody pointed to Canada. And Canada's having some real problems. They have old machinery. They don't have access to the technology that we have. Dogs can get MRIs faster than human beings can in Canada. It's a real problem. Now, I'm not saying the United States is perfect. Over 50% of the money that goes into U.S. healthcare is controlled by our government. We've not had healthcare for over 100 years. There's a lot of interventions that have gone on, and it would take a whole class just to go into them, about why our costs are as high as they are. And most of them are due to artificial barriers placed by government causing more expensive health care. As I said, there's no perfect system. There's no system without dysfunction. But there are always going to be limits, and it is a fantasy to think that you can, by magically running money through the government, have more efficiency than you would have being in charge of your own money. Now, are there people who need help? You betcha. And do I care about those people? I do, and I happen to think freedom and the wealth that it creates will be the best system for those people in the long run. So we can't just look. Another economic principle that's very important is what's seen and what's not seen. You have to look, like I said, longer term, not just at one group that you want to focus on. So it's very easy for people who propose government solutions to our healthcare challenges to point to the successes. And what you don't see is all the drag on the economy that occurs, the lack of innovation that occurs, the lack of choice that people get because you're handing your money over to politicians and bureaucrats in order to run this system. Medicare looks as good as it does this far because it's working on borrowed time. And if you're paying attention to what's any of the budget discussions that are going on in Congress, this country is in huge, huge trouble with how much we are in debt and what a larger and larger portion of our country is going to just running the government. And with the baby boom that's coming, we're going to start eating into Medicare and Social Security even more. So it may have looked good up to this point, but that's because you and your children are going to end up paying for all the health care that my parents and my grandparents got with Medicare. So there's no such thing as free health care. There's limited resources. Whoever gets the money gets to set the limits. And a question is whether you think you can spend your money better or whether you want to hand it over to the bureaucrats and the politicians. And it still leaves lots of rooms for charitable acts and taking care of the people who need our help. But it means we do it voluntarily.
So now we'll begin our question and answer session. If anybody has any more questions, could you please send them down the aisle so we could collect them? I think there's a few back there. So if Dr. Song and Dr. Haynes could take a seat on the stage. Yeah, absolutely. So this section will last 15 minutes. A few of you have submitted questions, and we'll begin with these questions. So the first question is for the affirmative. Can you please explain how a single-payer system would be modified to prevent Medicare fraud? Many argue that Medicare is the most inefficient system in the United States.
So I'm glad that question was asked. That's something that's been perpetuated throughout. But again, there was a study that was just done, and I actually have a copy which I'll give. It was in a big, prestigious healthcare economics journal written by Kip Sullivan from Minnesota that showed the administrative costs for Medicare right now are about 2%, which is far better than what's done in the private sector. With regard to fraud, I think that is something that the government is trying to crack down on. Recently, just as part of the Affordable Care Act, which, as many of you can tell, neither of us are big fans of, there was several $100 million that was placed into the Affordable Care Act to crack down on fraud, and they've actually prosecuted and gotten quite a bit of money back this year, several hundred millions of dollars in fraud. So that is something that is possible in any healthcare system, just like many of you who have private insurance who maybe allows one of your friends to fill a prescription under your name. There's a lot of that going on, but that's only a small portion. Again, when you have an industry that takes 31 cents of every dollar away from actual patient care to put into their pockets, that's a big, big chunk of change. Single payer is not asking for any more money to be put in the system. If anything, it will save money. It's $400 billion a year by eliminating that administrative waste.
Thank you. This is a question for the negative. Dr. Haynes, you had said in the free market healthcare system you have the ability to choose what you pay. What about those of us in society who cannot afford to pay at all?
I think that's a great question, because a big part of what we are facing right now in the United States is the fact that so many people have been priced out of healthcare. And you have to understand, I think these people are victims of the government interference. Healthcare costs in the United States started skyrocketing after the introduction of Medicare. And it's because basically the government wrote a blank check for people to get whatever care they needed, and there were no limits put on it. Gradually, those limits have been squeezed. There's all sorts of mandates about what has to go into health insurance. I mean, as a physician, I'm actually not for physician licensing. I think that makes healthcare more expensive. I would like to see nurse practitioners be able to hang out their own shingle. And they can give very good health care. It'll be a different thing than you'd get from a physician, but you would get good health care for a lot less. We have licensing. That's a government intervention that prevents, creates a false shortage. There's a wide variety of interventions that the government has done that restrict supply, artificially increase the cost of health care, and we need real competition to get that back so that it is affordable.
Thank you. The next question is addressed to both speakers, so we'll start with the affirmative and then go to the negative. Could both the speakers talk about preventative care? Particularly, how does the free market system impact preventative health care?
Well, the current free market system or the insurance-dominated system discourage preventative care. And that's why, as part of the Affordable Care Act, which was one of the good things that implemented, was that insurance companies could no longer deny payment for preventative care, such as mammograms and pap smears and things of that nature. Because of that, and because of the penny pinching and gatekeeping by the insurance industry that prevented you and I from getting these preventative tests, patients were diagnosed with much later disease states, and that ultimately drove up the cost of health care. So again, here's an example of where the private industry was at odds with what is really in the best interest of the public good.
Thank you.
A big part of the problem that we have is what we often call health insurance is not health insurance. There's a good reason we don't have an auto insurance crisis, and we don't have a life insurance crisis, and you don't have a homeowner's insurance crisis. It's because they are not as regulated and have not been interfered with as much as health insurance has. And one of the things that's been done is tax incentives for first dollar coverage, so that inexpensive, predictable expenditures are now being put through the health insurance. It's a very expensive way to pay for them. So one of the things that the Affordable Care Act does exactly in the wrong direction is it moves us closer to more and more prepaid health insurance rather than true health insurance, which would be catastrophic coverage. You can predict that you're going to get sick. You can predict that you're going to have wellness checks, and you ought to have certain health screenings and immunizations, and those would be affordable, just like getting oil changes or a new transmission. You don't pay for those with your auto insurance, and there's a good economic reason for that.
The next question is once again for both speakers. This time we'll start with the negative. I'm rich. Do I deserve treatment over someone who is poor because I can pay for it?
You don't deserve more or less, right? You deserve your own property. And if someone is ill and can come into your house and take your property away in order to make them pay for you, this creates a kind of society where we're all threats to each other. Again, you've got to look at that, think about that last chart that I put up, where in the least free, the poorest had to go along with $1,000 a year. In the most free, the poorest are the best off. If we had a truly free market and had an abundance of resources put into healthcare and things were affordable, people could live their life. We're starting to price people out of the ability to live because the amount of government intervention that we have. And it's not just healthcare, it's all across the economy. So the solution is to free things up and make life and health affordable.
Thank you.
I would just say that with the last comment about auto insurance. So the state of California passed Prop 103 many years ago that since then auto insurance rates have come down dramatically. And auto insurance, everyone who drives a car is mandated to actually own insurance. With regard to this, again, this economic freedom, when you go to the other countries that have greater economic freedom, everyone there has health insurance. And not having that burden of, oh my goodness, how am I going to pay for this if I get sick? Or if I start to feel sick, I can go see somebody. That's real freedom. The being stuck with your illness and not being able to go seek health care because you can't afford it or you'll go bankrupt, that's not freedom. That's not what makes a free society.
Thank you. This is a question addressed to Dr. Beth Haynes. Don't insurance companies already dictate what types of treatment which doctors can see Don't insurance companies already dictate what type of treatment which doctors can see, similar to how you argue that the government will control these factors?
Again, a lot of that has to do with the fact that we have made tax incentives to have prepaid health care. If you had true insurance, there would be a lot less of that control going on. Also, there's interference by the government that has restricted, so we don't even have real competition. Dr. Song mentioned there's 1 or 2 insurance companies in each state that really aren't in competition with anyone. Why? It's because the way that the regulations have been set up, that it's made it not viable for smaller competitors to come in and challenge these larger health insurance companies. So it's actually the lack of competition that creates near monopolies. And if you want to go to a full monopoly, then you go to single payer, right? Why is it considered, monopolies are considered bad in every other segment of our entire economy, and people want a monopoly of the government control over one of the most important things that we can have, which is our health care.
Thank you. This is a question for Dr. Song. Do you think the quality of care will decrease with the sheer number of added patients to our healthcare system, keeping in mind that we have 7 million uninsured individuals?
That's a legitimate question. Whether or not we have single payer, free market, the Affordable Care Act, is that we don't have enough providers in the United States to keep up with the number of people that are here. One of the big concerns of the Affordable Care Act is now that you've given people insurance, are there going to be enough primary care providers? So that is a very legitimate question. Regardless of what ultimate system gets adopted, we do have a shortage of providers. I agree with Dr. Haynes that we need to have more nurse practitioners involved to be able to take care of patients. We need to incentivize more and more people to actually go into medicine, which is starting to wane here in the United States. Whereas unlike that in Canada, the number of people applying to medical school has been tripling every year. So those are very legitimate concerns that we all have.
The next question is for both sides. I'll start with the negative. How would both health systems affect groups such as immigrants and families of lower income or no income at all?
So with a free market, you would be able to get health care from practitioners at various levels of expertise. Part of what makes healthcare so expensive right now is you can't get a practitioner unless they've gone to many, many years of school. Not all problems need a doctor, but it's illegal to practice medicine without a license. So if you had a true free market where people are able to offer their services as their skills and expertise allowed them to do that, people would have access to a wide variety of things that are available. More and more, with the internet and the ability for people to access information, support groups that are going on that are available through the internet, people can access a lot of information about healthcare and gain things much less expensively if we would allow that to happen.
With regard to the immigrant question, I mean, I think this is, again, a very good question because there's a big fallacy that's being perpetuated by a lot of Democrats, such as Speaker Pelosi, who say that the Affordable Care Act was universal health care. There'll still be 30 million that are uninsured, and the majority of those will be undocumented. Even with the DREAM Act, those people will not be covered under the Affordable Care Act expansion. The good thing about a single-payer system is it's everybody in, nobody out. That the amount of money that you would save, $400 billion a year on administrative waste, could more than insure every other person in the United States. Remember, the Affordable Care Act total price was 800-something billion, right? We're talking about saving 400 billion a year. And think of how many more people you could take care of, and that would be everyone, regardless of your documentation status.
Thank you. Now we'll be having closing statements, so we'll begin with the affirmative.
So again, thank you so much for allowing us to come and share our differing views on this. I do think there are a few things we do agree on. One is that the Affordable Care Act was not all that. Secondly, that the free market is non-existent in healthcare. And I'm not sure how you restore the free market in the utopian way that Dr. Haynes would like to. What I am proposing is based on facts that have been done in multiple industrialized nations who have managed to insure every single person in their countries at half the cost of what we do in the United States. We don't need to put any more money into the system. We just need to take the for-profit industry that cares nothing about your health or my health out of the system. With regard to the political appetite, this is where the difficulty starts. In the state of California, we've had a single-payer bill through the state legislature many, many times. Several times it passed, but then was ultimately vetoed by Governor Schwarzenegger. When Governor Brown finally came in, we had a Democratic House Senate majority, but that's where we had 6 Democrats who refused to vote in favor of it or voted against it. We have the more than majority opinion in our state that wants to remove the for-profit, unethical private insurance industry out of our system and replace it with a system that will take care of all of us in a cheaper, better way. Thank you.
So economic freedom. The consistent application of individual rights to the realm of production and exchange is unequivocally superior to government planning and central control. Market-based health insurance and single-payer are just simply 2 expressions of the wider fundamentals of freedom and individual rights versus that government control and collectivism. Economic freedom is superior practically because it creates the prosperity necessary to provide affordable, quality health care for everyone. When you look at the vast bulk of the evidence, the freer the country, the wealthier, and the wealthier, the healthier. And in freer economies, everyone is better off, rich and poor. And economic freedom is superior morally because it demands a recognition that each person owns his own life, but we do not own and we do not have a moral claim on the lives of others. The insistence upon voluntary social interactions not only allows for acts of charity, but it creates a benevolent sense of community which engenders goodwill and generosity. We are on the verge of an age of medical excellence. There are technologies available now that can literally let the blind see, the deaf hear, and the crippled walk. And just like cell phones 30 years ago, these are currently beyond what the average person can afford. We need to remove the regulatory obstacles, not pile on more, and unleash the entrepreneurial creativity that drives progress in a competitive system of profit and loss. We need win-win voluntary exchange, not win-loss political control. We can have human flourishing at the speed of voluntary exchange and free enterprise, or we can have health care at the speed of government. Which do you think will save more lives?
So we'll be having one final vote before you all leave. So if you could take out your iClickers once again. Also, several of you had submitted questions, and we didn't get a chance to address all of them. So if you guys would like to ask your questions to the speakers, you can come up after the debate is completed. Yeah, it's all the way at the end. There we go, back. If you can open up from 64. Oh. Well, we can just... Also, if you'd like to submit your email addresses and haven't done so, if you would like, you can write it down on the note cards if you haven't submitted your question, or come up to the stage afterwards and we'll collect your email addresses from you. All right. So once again, we'd like to ask your opinion on the resolution today. So A for agree, B for disagree, and C if you're still undecided, which we hope you're not. Sorry? Okay, yeah. So agree once again is for single payer, disagree is for free market. And if they're done, we can put it up.
So I was going to say give them 30 seconds.
Thank you.